We are excited to announce the addition of a small animal emergency and critical care referral option through the Referring DVM Portal. The goal is to enhance how medical records are shared for emergency cases. Not all emergency cases require a referral, but utilizing the portal provides an efficient way to submit referral information for patients needing emergency care through our hospital. Currently, referral information sent by email must be filtered by clinic staff and then redirected to the appropriate service doctor. Using the portal eliminates this extra step by posting the information directly to the Emergency Services Information Board. This streamlined process strives to improve internal communication and allow us to respond more quickly and access patient medical records. We continue to ask that either the owner or your clinic give us a call before the pet arrives. This ensures that we can properly prepare to provide the necessary care. As you know, our emergency service continues to face capacity and staffing challenges, and this advance notice helps us better allocate resources. In cases where we are at capacity, we may need to redirect the patient to an alternative option or coordinate a more suitable arrival time based on our availability to provide care. So for the emergency cases, the portal includes a referral form. After you select from the drop-down menu, referral, the form will populate. Here we ask that you input the patient's information as well as the owner's information. We ask whether the client's going to give us a call or you have given us a call. There's an area to fill in case information, any exam findings, any diagnostics that have already been performed, what your problem list may be, and then any medications that were given to the pet. There's an area down here to attach files. So this is where you can attach the patient's medical record, which can include lab work or any imaging such as radiographs. Here we ask for you to input the primary veterinarian's name and preferred callback number. That way, if we have any questions regarding the referral information or after the pet arrives, we know who to contact. There's an option to save the draft for later if you need to come back to it. You're able to delete it if you decide not to refer, or you can click send. Once you click send, it'll say, "Are you sure? Are you ready to send?" And you can click OK. Or if there's any portion of the form that needs further review, it'll prompt you to that. The portal is designed to reduce delays in communication, ensuring that critical medical information is sent directly to the medical team providing the care. This means we can potentially avoid redundant diagnostic work, such as the need to repeat any blood work or x-rays, by using the records you provided to inform our diagnostic process and then determine if any additional testing is needed. We hope this new portal option improves the flow of information and enhances the care we can provide for your patients. Thank you for your continued partnership.